Thom Hartmann here with you, and super pleased to have on the line with us Congressman Mark Pocan. He is the first vice chair of the House Progressive Caucus, or the Congressional Progressive Caucus, I believe it's called now. And his website, Pocan, Pocan.house.gov. You can tweet him at Rep. Mark Pocan. Congressman, welcome back.
Thanks, Tom. Glad to be here.
Oh, and it's great to have you with where we can see you, too. So just to let everybody know, you'll be here for the hour taking phone calls. Our telephone number is 202-808-9925, and you can ask Congressman Pocan pretty much anything you'd like. Congressman, what's your take on what's going on in D.C. right now?
Oh, boy. What a week, you know, from the CBO score coming out on the Republicans' health care bill, which now we have to quit calling a health care bill. This is a tax cut for the wealthiest Americans with a little side of health care. This has very little to do with health care other than taking people away from having access to it. So that was on Monday. Then I think yesterday we saw the court strike down the second Muslim ban, which for many of the same reasons, that it's a targeted, bigoted proposal. And today, this morning, we got the president's skinny budget, which by skinny, I guess, means it makes poor people skinnier because he's cutting most of the programs that actually help the middle class and those striving to be in the middle class, and puts a whole lot of money, $54 billion, into defense. And if you look at the cuts across the board, you're talking 20, 30% cuts on programs that actually benefit real Americans. So once again, the promises from Trump, whether it be that everyone would have health care, proven false, whether it be that this wasn't a ban on one specific religion, again, by the courts, proven false, and that he was going to look out for working families. The people in Wisconsin who voted for him have been left behind again. So it's been quite a week.
Yeah, it's fascinating to watch. Donald Trump filed for his 2020 campaign on inaugural day, and this has allowed him. He's sending out these emails. I'm on his email list. I sent him $5 back a year and a half ago, just to get on the list and to get on his donor list. And it's amazing. I mean, the emails that are coming out every couple days talking about all the accomplishments and please give us money and please fill out this survey and give us money. They're really, really doing a good job of marketing him. And then he has this town hall like he had yesterday, or this event that, because it's paid for with campaign cash, they're calling it a campaign event, and they only allow people in who are donors to his campaign. So there's no dissent. Whereas all the Republican members of Congress, whenever they try to hold a town hall, they're not doing it that way. And so they get actual constituents rather than just sycophants. Is this a brand new way of doing politics that Trump is doing? I've never seen a politician be able to select his crowds like that.
There's so many things he's doing new, right? I mean, now we have news and fake news, and apparently everything that doesn't say he's wonderful is fake news. We've got facts and we've got alternative facts. As opposed to the alternative reality that he appears to live in. And, now you've got this sort of thing where he's only going to listen to the people who either give him money or already support him because he loves to have his back patted and told how great he is, when in reality he's going to be gutting programs in healthcare for tens of millions of people. So it's a real interesting time to be watching this and watching what the Republicans in Congress doing. Because if they take this Trump Care proposal, which again is really nothing more than a tax cut for the wealthiest Americans with a little side of healthcare, but cuts 24 million people off of access to healthcare and makes older Americans pay even more. I mean, this is not good. Even the base doesn't want this. I talked to a Trump supporter the other night who said, I didn't think he was going to do this to my health care. And then they brought up another issue. I go, yeah, he stopped that protection from the Obama administration as well. In the end, they didn't know what they were getting with this because right now he's pretty much governing for the wealthiest and the oligarchs, and the rest of us are kind of left behind.
Yeah, and also he wants to bring back subprime insurance policies.
Well, he wants to bring back a bunch of stupid things. I was just looking at some of the top lines of the budget proposal that came out this morning, and he's adding 20 lawyers to justice just to help him. I think it's to justice, but 20 lawyers he's adding just to help him acquire the land to put his border up, because there's going to be some landowners who don't want a big fence or wall through their land, and now he's got to go after those people in order to put this this little fantasy of his up. There's just some many things, Tom, that, it's kind of like during the campaign. Remember, any one thing he said would have killed most campaigns along the way. And he just had so many of them, you became desensitized. The difference is this time I'm hearing from people back home. I had a town hall in Baraboo, Wisconsin on Monday. People are afraid and fighting back on healthcare and on all the other things he's doing. So people are realizing we're having victories, but they're speaking out, and that's how we're going to win. So I'm very optimistic, despite seeing these terrible things introduced every single day, because I know the people aren't with him on this.
Yeah, I was just so struck by the contrast between the Republican town halls where people are yelling at them and the Trump campaign rally yesterday that he held. I think it was in Tennessee, where it was just pure people, just on their feet, for him, and no matter what he said. And I was like, wow, this is amazing. Coco, watching Free Speech TV in Brandon, Florida. You're on the air with Congressman Pocan.
Good afternoon. What a pleasure to talk with both of you.
Thank you.
Thank you.
Congressman, both of you. Every day I try and make 2 calls to go into 2 members of Congress. And I say, here's a hot tip for whoever it is. And then I say, Google this. Harvard study, 2009, 45,000 people die prematurely because they cannot afford health care. And then a couple of things. The thought is what I've come to realize is that, as learning from you, Tom, for over a year, a full-time, your university, what I come to realize is that this country is not a democracy. It's not a corpocracy. It's not an oligarchy. It's more of fascism. But even worse than that, we have a deathocracy because we put money and power over people dying and suffering in this country. And I really believe that this healthcare issue should be turned into saying it for what it is: death and suffering.
Yeah. Coco, is there a question in there for Congressman Pocan?
So that's it. How can we get this message? I believe that this message of using this death of how we're destroying people.
Congressman?
Sure. I think the real message for me, and while you're completely right, if people don't have health care, you're going to have more people sick and more people dying, and that's absolutely a part of the argument. But, really, the CBO made it perfectly clear. This is not a health care proposal. This is a proposal to cut taxes on the wealthiest. Over half, or just about half of it, just to the top 1% and 2% of people. And then we're getting a side of healthcare with it. And that healthcare doesn't cover people. You're going to have tens of millions of people losing access to healthcare. So everything you said is correct on that front. But I do think that we really have to let people know they're not finding a replacement for the Affordable Care Act. All they're doing is doing a backdoor way of trying to make sure their wealthy donors get to pay less in taxes, therefore have more money for them. That's the bottom line.
Okay. Congressman, we just have a minute to the break. It would be unfair to put somebody on for that period of time. Do you think that the Democrats are forging a coherent response to this? And if so, why is not the core of that response being a proactive solution? We want John Conyers' H.R. 676. Is it because there's not unanimity among Democrats behind that?
Yeah, I think the thought is right now, the proposal before us, we're trying to fight, and it's a bad proposal, and that's where most of the energy is going. I think, the Progressive Caucus, for example, and others put out positive, proactive proposals. But right now, the energy is around showing people just what this is and isn't. It's not about health care. It's about a broken promise, again, by President Trump and by the Republicans. And I think we're trying to really push strongest on that.
Is H.R. 676 in play right now?
Because we don't have the ability to put anything on the floor, it isn't, but it is as part of what we talk about as alternatives.
I see. Okay, we'll be back with Congressman Pocan in just a second.